Yes, thank you so much for that reminder.
Yes. All of a sudden I didn't see a little red light. So, okay. So Amanda, thank you so much for entering into the chat. Lisa, thank you so much. So I'm going to read some of the issues that are coming up in the chat, just so everybody has access to the information, just in case you can't see your chat. So Amanda would like to know how often someone is likely to go back into an abusive situations due to health concerns. Wow, that's a really good question. Okay, so hopefully I'm going to be able to get to that. And Lisa, I'm a hotline advocate and often speak to people soon after sexual assault. I'm interested in how to better address these callers' needs. Awesome. Okay. All right. Hopefully we'll be addressing that as well. And if anybody else has any questions that they want, and then please feel free, seriously, to enter into the chat questions, comments, anything that comes along. It's a nice small group, so it's much easier for me to pay attention to the chat while I'm doing this training. Okay, so I had some goals for our discussion today. So I'm gonna dig in a little bit on why adult survivors of child sexual abuse have more complex healthcare needs than other survivors. But we're still going to be covering kind of the healthcare needs that survivors have, generally speaking. And the handout information is more general for survivors of domestic violence and sexual assault, and it applies across the board. A lot of times I'm writing things or designing things, and I'm covering the issues that someone like me would have if they're seeing an advocate. I'm not always saying that that's what I'm doing, but the things that help are generally universal. So, but I'm going to dig in a little bit around adult survivors of child sexual abuse, because we've been doing kind of a series of webinars to address issues around adult survivors. So this is one of those. Okay, so the other thing we're going to do is we're going to examine what makes accessing healthcare so difficult. And I think that in this issue, we'll get to some of the things. Lisa, I think it'll help you in terms of talking to people when they call in, and then explore how you can support adult survivors in caring for their health. I'm just noticing my typo in there. I always hate when that happens. Okay, so I'm gonna get right into our material. So why do adult survivors of child sexual abuse have complex healthcare needs? And if you have some ideas about this, please feel free to enter them into the chat. And also, if some of the issues that I'm bringing up seem different or new to you, it'd be great to hear that as well. I have a feeling that a lot of this stuff's going to make a lot of sense. Okay, so adult survivors of child sexual abuse have complex healthcare needs for several key ways, for several key reasons. One is there might be injuries from the abuse that they haven't dealt with, that then become issues for them as adults. And I'm gonna show you. So I'm gonna go through these slides, and then I'm gonna kind of give you an inside outlook from my perspective of growing up in a home, being sexually abused, and then experiencing violence as a youth and young adult. And I'll kind of show you some of the complex healthcare needs that came up from the issues that we're going to be talking about. So some of the things will be injuries from the abuse that happened that they never never had a chance to address. The other thing is that coping strategies that help us survive and function and do well can also, over time, those can create health issues for folks. So the things in which, so the thing about adult survivors of child sexual abuse is that we're kids when we're being abused, and we don't always have access to good coping or really kind of a way to stop the abuse or anything. We just kind of have to rely on whatever we can find. And so when you're thinking about kids being abused, the things that we can find are going to be right around us, things that our friends have access to, and then also things like internally. So, for example, one of the things that I relied on quite a bit was dissociation. So I was able to kind of leave my body cognitively. And that, as the abuse continued and continued, that was my main source of coping. And then, it's an amazing coping mechanism, but it can really kind of work against you the more and more that you use it. So that's what I mean in terms of that there are coping strategies that can cause health issues over time. And then also, trauma changes a survivor's brain. And a good place to kind of think about this is the book, The Body Keeps the Score. It talks about kind of the ways in which trauma changes the neurological response to what feels dangerous and what, and what's not, what isn't dangerous. And so, and then that has issues for survivors without some healing, without processing that trauma. It can create issues for survivors and their health because obviously the mind and the body are connected. So then, and the last reason that adult survivors of child sexual abuse have complex healthcare needs is because healthcare settings can be triggering for survivors. So the issue there is that if you get triggered each time you go to the doctor or to some sort of healthcare setting, a clinic, a dentist, anything like that, then you stop going. And then those issues that either from the abuse, from your coping strategies, from the way that trauma changes a survivor's brain get worse with unintended, without having any kind of intervention. So, okay, so those are really just some of the key ways in which it's different for survivors who were abused as children. Survivors who are abused as adults for the first time as adults will also experience some of these. They'll experience the injuries from abuse. They'll experience some of the coping strategies that if they aren't able to process that trauma, or if they use those coping strategies for too long, that can present health problems for them. And trauma changes a survivor's brain, but it's different. And so the best way that I can describe this, and I'm hoping that this makes sense, but the best way that I can describe this is that if you're abused by an intimate partner as an adult, it changes your life. It totally does. If you experience sexual assault as an adult, it changes your life. And it basically alters the course of your life, because now you have this this trauma that you've experienced from someone you were supposed to be able to trust. But if you experience something like this, hold on one second. I'm gonna close an application that is gonna start going nuts, I can tell. 1 second, I'm gonna stop this. Sorry about that. Otherwise, we're gonna keep hearing that pinging. All right, there we go. And I'm gonna go back to sharing. And coming here. There we go. And turn my slideshow back on. There we go. Okay. So, so like I said, if the first time that you're victimized by an intimate partner is as an adult, it changes your life, right? But if you experience sexual abuse as a child, it actually forms your life. And what I mean by that is that it alters the direction of your life. It becomes, the coping and the abuse becomes part of you as you go through your life. So it can affect normal development. And what I mean by normal childhood development is that it can interrupt some of the things, either because it's happening in your home or because the abuse itself created some dynamics in your home that kind of disrupt the normal childhood development, if that makes any sense. So I'm hoping it does. So that's so this is why I kind of want to focus a little bit more around adult survivors of sexual abuse, because it will have abuse and assault will have healthcare consequences for adults, but it's really embedded in the lives of people who experienced abuse and trauma as children. Okay, so all right. So one of the things that I want to remind us of, and I feel like this study is the ACE study. So the ACE study is the adverse childhood experiences to adult health. And what they did was, it was a study done by Kaiser Permanente years ago of people that lived in the San Diego area. I think it was, generally people that were participating in their HMO, health maintenance organization. And there were some really striking things that I think people who do this work totally get, and people who live outside of anti-violence work were stunned by. And so it showed that adverse childhood experiences lead to chronic health issues. And so clearly abuse and trauma, abuse and violence in childhood is an adverse childhood experiences. And the more adverse childhood experiences that you're exposed to, the more that it can affect your health, and in really significant ways, and chronic health in terms of, and so this is I should actually send this to you, Leah and Alexandra. This is just an executive summary of that report, but it talked about the issues of obesity, of blood pressure, diabetes, of smoking, like all these very chronic conditions that affect people who experience these adverse childhood experiences. So trauma in childhood is an adverse childhood experience, but what's really interesting that we are seeing in our society now, because this came out years ago, is that what we have talked about in our work has been how violence, physical and sexual violence, turns into trauma in the lives of kids and adults. But what we haven't talked about as much is how oppression turns into trauma, and oppression is adverse childhood experiences as well. And I think the reason that we have not talked about it in our work is because I feel like the work that we have done in creating our responses and talking about what happens to people and the neurobiology of people's brains has centered on mainstream white society. And so we're not talking about oppression in those situations. So I feel like we need to incorporate into our work the fact that the survivors that we that come to our services that are Black, Brown, Indigenous, and, or other people of color, or have disabilities, those survivors will have experienced more adverse childhood experiences, will have experienced more trauma because of the fact that in our society, being different is treated as less than, and being Black is treated with racism. So I just kind of want to put that out there for folks to think about, that as you're doing your work, that it makes sense that people who are BIPOC would also have an experience of trauma beyond just the violence that they experienced.
Hey, Olga.
So, Leah, I see. Yeah.
Yeah, we do have a question.
Awesome.
The question is, what could be some other challenges that immigration adult victims of childhood sexual assault have that U.S. citizens wouldn't face, and what are some ways to assist them with getting services?
Awesome. This is such a great question. Okay, so immigrant survivors are going to have the stuff that we just talked about. They're going to have experienced. So let's talk about the immigrant survivors that that we have been seeing focused in the news and across the nation over the past few years. And so I'm going to talk about the Brown and Black immigrant survivors who are in the U.S. who have experienced some sort of trauma in their home country, who have experienced trauma getting to the U.S. And then because of the way that we treat immigrants in our society, and I mean, in particular, recent immigrants, undocumented immigrants, the way that we have created a subclass of people, they are more at risk for exploitation and victimization. So when you're seeing them, if you're seeing them because something just happened to them, you need to be thinking about the fact that they have experienced almost 3 levels of trauma, starting from the country that they left, from the traveling here and getting here, and then whatever happened to them here. So there's going to be trauma on top of trauma on top of trauma. And then what you have is, if you layer in the oppression that they don't have documentation, that they may not feel safe at any point in time, depending on where they live in the country. I mean, I live in rural Wisconsin, and I have I'm Latinx, but I'm gender nonconforming. I have DID. I'm queer. Like, I live at all these intersections, but I'm a citizen. I speak English. I'm well resourced, and I don't feel safe a lot of times in my community. So I can't even imagine how people who are undocumented, who don't speak English, who have been targeted, would feel unsafe. So you have to factor all that in to your work with them. So oftentimes you have to find ways in which you have to find ways in order to work with them that enables them access to healthcare, enables their ability to earn money, to be able to drive and get around. Because in a lot of states, People are not able to get jobs legally. They are not able to get driver's licenses legally, and on and on. So there are all sorts of limits, and which of course makes them easier to exploit. So this is where a lot of times victimization comes in. This is human trafficking, domestic violence, sexual assault, all those things become factors. So looking for ways in which, looking for clinics that don't ask about immigration status, that serve everyone, that don't, free clinics oftentimes are community clinics, are these community mental health care is also a great place to go for immigrants. Making sure that you have access to interpreters in person or bilingual, bicultural advocates. Those are all going to help your work with them. And then on top of that, then the stuff that I'm going to talk about here. So I'm hoping that that's an okay kind of answer for now, and I'll keep coming back to it over and over again. Another thing that you'll have to think about for immigrants, especially people who are undocumented, but even if they do have documentation, and this is true as well for BIPOC survivors, which is basically you can't, your safety planning with them really has to incorporate oppression. You can't just rely on formal system responses for them for safety, because oftentimes that's not safe for Black and Brown communities, and for sure, again, for immigrant communities. So you have to think about more creative ways of safety planning. And there's the upcoming webinar that the organization that I work with in my day job, we're putting on, and it might be interesting to you. You can sign up for it. And Leah, I'll send you that link. It's called Transformative Justice in the Lives of Survivors with Disabilities. And I raise this, I know we're not talking specifically about people with disabilities, but transformative justice is something that's been going on in communities of color and for BIPOC people with disabilities for decades now. And so we're going to be talking about what it is. We have a panel of two folks. I'm going to facilitate that webinar. It's going to be Najma Johnson, who's a Black, deaf-blind, transgender, gender nonconforming person who runs a program, deaf advocacy program in the DC area. And then we're also going to have Leah Lachmi Pipesna Samarashina. I'm totally massacring that name. Anyway, Leah has written a number of books, one of which is Care Work, and the other one, which talks about transformative justice, is called Beyond Survival. If you work with immigrant survivors, I would tune in for that webinar, because I think transformative justice is an option for safety planning and work with Black, Brown, and immigrant survivors. So, okay. I hope that answers your question. All right. Oh, and Leah, you have the, okay, awesome. All right, so I want to kind of frame this discussion about healthcare after abuse. Okay, so I mentioned that I'm a survivor of childhood sexual abuse, years and years and years of childhood sexual abuse. The way that I coped with it was to develop PARTS, which is called dissociative identity disorder. If you've never heard of dissociative identity disorder, it used to be called multiple personality disorder. And this is a picture of me years ago when I was finishing up my work with the psychiatrist that I worked with in the healing process. And so I had the best care that somebody could get, just because I lucked into it. Just really honestly, I was referred to somebody who's one of the best in the world now, to deal with dissociative identity disorder. It was a specialty. I was a lawyer at the Department of Justice. I made a fair amount of money and had good benefits, so I was able to pay for the care that I got. And I kind of want to walk you through the impact of that abuse, the trauma, and coping on, some of the things that I found out. This is not all of it, but this is some of the stuff that I learned, because I kind of just want to show you how complicated it can be for adult survivors of child sexual abuse. And the easiest way for me to do that is to use my experience. So first, there's the physical impact of the abuse itself, and that's injuries, and then chronic conditions, like I said, that come from either the coping mechanisms that I used or the trauma itself. And then there was psychological impact. And I apologize for these transitions. I did this a long time ago for these transitions, and I keep forgetting to take it out. So the psychological impact was trauma. And what I mean by that is mostly post-traumatic stress disorder, also dissociation and dissociative identity disorder in particular. And also that my response to stress and being triggered is a response where I'm very accommodating or appeasing. So if you've heard people talk about fight, flight, freeze, or fawn response, if you've heard that term fawn, and that's F-A-W-N, like a deer fawn. That's what I'm talking about. It's a very appeasing, very agreeable, like falling over themselves, being catering or engaging with someone. I'll do that when I'm triggered. And that complicates healthcare, and I'll show you how that works out. So let's go into some of the physical injuries that I had that a lot of survivors will have. So I had broken bones that were never cared for. I had, fingers that were broken. I have a fusion in my back between the L5 vertebrae and my sacrum. And I had all kinds of gynecological injuries and infections that were never cared for, tears in my colon that I discovered as an adult. And then some of the chronic conditions that I had and still have actually is asthma, fibromyalgia, endometriosis. And this is just a few. Like, I have a really long list of things that I was diagnosed with and medications that I was taking. Now, this is most of this, well, all of this is prior to healing, and a lot more. And with a healing process where I'm kind of, processing that trauma and not living in it all the time, I improved my health, but I still have health issues because of, the psychological impact, the physical impact, and that I'm still going to get triggered in healthcare settings, even though I know it and I know what to do about it. It's just not going to stop me from getting care. So the impact of abuse around the psychological impact, like I said, was trauma, and that was PTSD under dissociation. That was a DID. The other thing that's important to know about dissociation is that when people rely on dissociation because they're kids and that's all they have, they dissociate all the time. And one of the things that really complicated getting good health care and taking care of myself was that I dissociated through pain so that I didn't feel it and I didn't notice that I was doing it. The other issue that complicates things is that people not only have memories of the abuse that come back or that never go away, which come through like in flashbacks and nightmares, but also people have body memories that they'll feel when they're experiencing a flashback or when they're triggered or when they're going through a healing process. And triggers can happen all the time and anywhere if you've been abused as a kid, because there's lots of things that will feel like the abuse that you experienced as a kid. So for example, I would often feel a sense of panic and pain if I felt closed in. So kind of like a claustrophobia, but this claustrophobia is connected to what happened to me. So that trauma processing helps with that. But just to give you an idea, the other thing that I experienced was and continue to have an anxiety disorder, which again affects my health and affects my ability to get care. Okay, so this creates a situation where it is difficult for me to get care for my health that I didn't know. Because trauma disrupted my childhood, I didn't learn when I'm supposed to go to the doctor. So I have to teach myself how to do that as an adult. And this is what you're gonna come across people with similar experiences. They're not gonna tell you everything that happened to them like I'm telling you, but you'll have people that just really don't know when they're supposed to go to get help with their health care. And when they don't have to. The other piece is that I was dissociating all the time. So I didn't feel pain. I wouldn't remember. I would go to my appointments and I would dissociate through my appointments and I wouldn't remember what I was supposed to do. Or I wouldn't give the healthcare professional the information that they needed in order to help me with what was going on for me. And then again, because anxiety would show up in my appointments or in any follow-ups, like if I have to have, I had to have some root canals done, anxiety made it really hard for me to get those done. I had surgery on my hands for arthritis that developed because of broken bones that were never healed. And anxiety compromised that care. And then I learned kind of how to talk to doctors and especially anesthesiologists about my anxiety and what's called trauma breakthrough, meaning that there are people that have experienced so much trauma in their lives that then when you're planning to do procedures with them and using sedation or anesthesia, you have to factor in that the body will still get triggered even if that person is out. And so you have to plan for that. And so what would happen is I would wake up during procedures because I didn't know that and they didn't know that. And so then I learned to let people know that you can't do anesthesia or sedation based on weight and height and normal factors. You have to factor in the fact that I'm going to get triggered even if I'm not awake, and my body's going to kick up and adrenaline's going to go through my body and I'm going to break through normal levels of anesthesia. So it's a really hard conversation to have with medical professionals because they immediately go, a lot of them have not heard of this, and they immediately go to suspicion around someone who is trying to seek additional drugs for that procedure, like that. And so I've had situations where anesthesiologists have not done that, and I've woken up even after I've learned that this happens. And so I pretty much talk to everybody who is involved in my care so that they know to look for signs of me waking up so that they can act quickly to prevent that from continuing. So I don't know if that makes sense, but it's a really important thing to think about and talk about with survivors, and also when you're doing training with medical professionals. So the other thing that really complicated my work is that my ability to care for my health was that I was very accommodating and appeasing. And what I mean by that is I would go to the doctor and I would talk to the doctor about what was going on for me. And I would kind of be like really talkative, and they would recommend something and I would agree to it, and not really think through whether I was really going to be able to do it. And then I would leave, and so I'm not having the conversation, well, that's not very practical for me, or I don't think that's going to work, or, and so I'm not having a real discussion with my doctor. And so I leave and I'm supposed to do stuff that's not going to work for me. And so then I don't go back because I feel bad that I haven't done what they've asked me to do, but I've agreed to it. So that piece of knowing that you do this and addressing it is really important for survivors. And so this is just I just wanted to illustrate the ways that complex nature of trauma as a kid shows up in adults seeking care. So I'm looking at the chat and I can't tell if there are any questions. Leah, can you tell? I'm guessing that you would jump in if there were.
Yeah, no new questions.
Okay, awesome. Okay, so I'm going to move into what advocates can do to support survivors caring for their health. And I have quite a few very specific, very specific guidance for you. And then also, I have a handout for you all that I'll talk a little bit about in a little bit. Okay, so, and here's where I would really love to hear if there are some things that I have missed that you do. So any of that in the chat would be awesome. Okay, so first, one of the things that I think is the most powerful to do with survivors is to normalize their sense of fear or stress around health, and around getting health care, getting dental work, and even really honestly, this applies as well, even though it's not the same. This applies for things like going to get your hair cut, any kind of any time that someone's standing really close to you, and especially close to your head, is really a possibility for triggering. So even though a haircut isn't, or getting your hair colored or whatever it is, even though that kind of thing isn't a health issue, I want to just flag it for you, because when you're normalizing someone's fear and stress, you can also mention that, which I think makes people feel a little bit more relaxed about what's going on for them. They don't feel like they're so weird. So normalizing and talking about it the way I've laid it out, like this makes perfect sense, because it can be triggering, because because you may end up with anxiety, because you might not remember it, because there are these ways that you cope, like that trauma makes sense that you would feel this way about getting healthcare. So that is really helpful right across the board. I mean, it makes people feel like they're not so weird. And then you start from a place of being more relaxed. Second is providing information about the way that childhood trauma can make it difficult for survivors seeking medical care. So that's the stuff, like this is how it affects your health. Like the stuff that you went through growing up affects your health because there's going to be things that happen to you that no one addressed. Because there are ways in which you survived that years and years later create problems for you. They're great coping mechanisms, but at some point they start to work against you. And what I mean by that is, and so this is a piece where you want to be really careful how you talk about this, because there's a lot of shaming that happens to people in healthcare settings. So I want to talk specifically about some of these coping mechanisms that people use and how those coping mechanisms are considered bad. And the fact that they're doing this or that they have health consequences for them has been part of their shaming. And so, so the one that I mentioned that I relied on quite a bit was dissociation. And that's not one that people know a lot about or that people consider bad. There's a bunch of other ones. Eating to deal with emotions, because that happens, right? After you're in this home where abuse is happening, no one's talking about it. People are coming in and out of your home. That all can be very triggering. Abuse in childhood feels very chaotic. So you go to the things that you have accessible to you. So what you have accessible to you is food. And even if you don't have a lot of food in your house, you still have access to food. Like I grew up poor, but we still had food. And I noticed that when I ate certain foods, that I would feel better than when I didn't. And it'll be silly things like I ate a lot of rice growing up, or I ate a lot of pasta growing up. I would just eat more, or I would go to friends' houses and I would eat candy and sweets, and then I would notice how I would feel, and I would keep doing that. I would eat junk food, and I would keep doing that. I would eat out, eat fast food, and I realized how I felt. It would help me feel calmer in the moment, and I would just keep doing that. And those are things that people will shame you for if you gain weight, if you have high blood pressure, if you have diabetes, if you have health conditions because of the way you ate, because the way you ate helped you cope with what was happening in your home. You're treated like you don't care about your health, when in fact, what you're doing is you're still coping. So I'm explaining all that to you so that when people say to you things that sound like shaming, yeah, I eat too much, or yeah, I drank too much, or I relied on substances, that you can normalize that. You can say it makes perfect sense because you were a kid when all this stuff happened. And when you're a kid, it's not like you can go away. It's not like, you have to cope with what's around you. And so if there's alcohol around you, or as you get older, your friends introduce you to alcohol and you realize you feel better, you feel more relaxed. It calms all that anxiety that comes from trauma and from being triggered all the time. It helps people feel better about what they've done. It's not as shaming. So this is a really important thing that you can do for folks. And that's a thing about working with adult survivors of child sexual abuse. It's so easy to help. It's just so easy to help. Listening, being present, helping people understand the experience, helping people not feel like they're so hard, because people have always told them they were. So anyway, okay, so that's one piece of it, that for you to remember, like when they're saying things that are shaming about the coping mechanisms that they use, help them to understand that it makes sense. That was really creative. And so now they don't have to use those coping mechanisms. Let's try to figure out what they need if they want to let those coping mechanisms go. So not pushing them there, but if that's what they're asking about, let's help them figure out what they need for that. Because now they have other options. Okay, so then work with survivors to consider what options they have about their health and help them have choices about what they can do for their health concerns. So do they go to the health clinic? Do they go traditional medical? Do they go to holistic? Do they go to a chiropractor or a, what are they called? Now I can't remember. A naturopath. Like health doesn't have to look one way. It's whatever helps that person. So helping them understand what options there are in your area. And then also that when they go, then they have choices about what they do and how they do it. And whether they do it at all, and reminding them that they have choices. You've gone to this person that you've hired to help you. They've told you, here's what they think will help. And then they get to make decisions about what they do with that. And then also find people in your community who are holistic and who have a supportive healthcare approach. And what I mean by that is people that are trauma informed. People that don't shame survivors. And people that kind of have an understanding of the impact of violence on people's lives. So if you can find those kinds of providers in your area so that you can offer those resources to people that are struggling, and then for them to decide where they want to go if they have those options. And then assist survivors determine what they need from a medical provider. And what I mean by this is help them kind of like figure out, okay, so they're having this health issue and they want to try to address it. And so finding someone who addresses it, getting an appointment and kind of figuring out, okay, so what is your goal in doing this? What is it that you want to come out of this? And so let me give you an example. So because one of the injuries that I had when I was abused was that my back was injured and it was never cared for. So my lumbar, the lowest lumbar in my back, fused to the sacrum area. So I have a fusion between L5 and S1, if that makes any sense. So because of that, I've had back problems my whole life. So what I'm trying to kind of go, so when I'm talking to someone, okay, my back is really bothering me, I think I want to get some care for it. Then the question is, so what's your goal in getting care? Like, do you want like a medical approach to care? Do you want a chiropractic approach to care? Do you want a physical therapy approach to care? Meaning, do I go to someone who's going to take x-rays or MRIs? Do I go to someone who's going to adjust me and help me manage pain? Do I go to someone who's going to teach me how to do exercises and how to create an environment for myself that limits how much my back bothers me? Or do I want to do all of those if I have access to them and the insurance that'll cover them, or the resources to pay for them? Do I want to go to a naturopath who is going to help me to relax through herbs and essential oils and the foods I eat, that might then reduce tension in my back. So it's kind of like, what is my goal? Do I want to try to eliminate the pain in my back? And is that possible? Or do I want to try to minimize and manage the pain in my back? And so this is what I mean by kind of trying to figure out, like, assisting survivors determine what they need from a medical provider. Like what's realistic for me? Like, it's not really realistic for me to think I'm never going to have back pain again, but I might be able to minimize it. So knowing ahead of time what I want or what I want to try to do, even if it's not possible, but to have that discussion so that when I go in, I know what I'm talking to this professional about. So what else can survivors do? So that's a segue into help survivors prepare for visits. So oftentimes people don't know that they have a hard time at the doctor. They might feel anxious about going or really don't want to go, but oftentimes they don't know. And they don't know why. So again, going back to help normalize this is really important. But then what's going to help them get through that situation? And I have a brochure that I've developed. It's actually kind of like a little bit of a fact sheet that I've developed that talks about things that people can do to prepare for visits and to how they can structure their visits. And it's based on what I learned to do to take care of myself. So, so ahead of time, you could identify medical professionals who are trauma informed or who get anxious survivors, or what they think about as anxious patients. They don't always get that it's not really that we're anxious, it's that we've been traumatized and it shows up because we're triggered. But having people that understand a trauma-informed approach, that have a really good, for lack of a better term, bedside manner, like their rapport with people is really good. That's a really important referral for someone. So if there isn't someone like that, then having a sense of what the professional is that they're going to see and having a plan for how to deal with it. If they're kind of brusque, but they're good, how's that survivor going to do in that visit? So having this kind of conversation with them. In addition, you may, the other thing you can do to help them prepare for visits is write down what kinds of medications they're on, what kinds of issues are coming up for them. So if you go in for one thing, but you don't remember to talk about something that affects it. So I might go in for high blood pressure, and I don't tell them that I have a really bad back and that's why I can't exercise, or that I have trauma and that makes it really hard for me. You know, I'm constantly getting triggered and that affects my ability to manage my blood pressure because, you know, I can't when you're constantly getting triggered. So that's what I mean by kind of like helping them kind of write down some of the things that they want to remember to tell their doctors. The other thing that is important to do is whether they're going to share to that with that healthcare professional their past, that they've been abused. I don't always share right away. If it's a new doctor, sometimes I do because the reason I'm going in is related to that, or because of something that I'm going to ask for. I need that. So if I'm going in for a procedure, I realize I'm going to have to make sure that doctor knows that I have trauma in my past, and that gets kicked up when I'm sedated or in anesthesia. So having a plan for them to think through, are they going to disclose? What are they going to disclose? What kind of doctor are they seeing? Do we know anything about that doctor? Those are the kind of things you want to help them do. What medications are they on? Are there any complicating factors to what's going on for them? So then the next thing is consider accompanying survivors to medical appointments when they need added support. And I'm going to say, for survivors who are recently working with you, who've been triggered for some reason, even if the abuse happened a long time ago, but there's a recent event that has triggered them, then you're probably going to need to accompany them, and you might want to offer to accompany them. And if your organization doesn't allow you to do this, I would push back on this. With adult survivors of child sexual abuse, this is what advocacy looks like. It's different than people who weren't abused in childhood. And so the advocacy skills that we need is really important. Sorry, you might hear this, I'm lowering my standing table. I really do have a bad back and I have to stand up every hour. So I would strongly urge you to offer to accompany survivors to medical appointments. And if they say yes, great. And if they don't, that's fine. But then suggest to them that they might want to have somebody else support them during that appointment. Help survivors advocate with medical providers. So help them. And this is all the things that I've described so far is going to help you do this. So the fact that they know that this is normal for people who've experienced trauma as kids, and even trauma just as adults, knowing that this is a normal thing, that going to the doctor is hard, that you're going to have physical and health issues, and so you should be able to go to the doctor, is going to help them to advocate. So practicing with them, talking about what their fears are, and what they can do should those things happen. And then also, whether you're accompanying them or doing training, advocate for survivors with medical providers. This is and it's really hard right now because healthcare providers are so burned out right now. So they're not doing their best work. And when they are doing their best work, there's shaming that happens. People are discredited or deemed not competent because they don't know enough. Like somebody says something and the doctor kind of shrugs it. I mean, and this actually happened to me when I was talking to an anesthesiologist about trauma breakthrough, and he walked away from me. Those are really common occurrences in healthcare. So advocating for survivors with medical providers, and this is a good conversation to have with survivors if you are going to accompany them. If I'm having most of my medical appointments, my partner doesn't go with me to, but if I'm having a medical appointment that I'm worried about, that I feel like I'm going to have to push the medical professional, or if it's something involves sedation or, something more involved, like in January, I have to have a colonoscopy. That's going to be hard. My partner goes with me, and we have a conversation about how much I need her to advocate for me if I'm unable to, meaning that I get to this accommodating, appeasing place, then I need some help. So having those conversations and being willing to do that is really important in these situations. So what else can you do to support survivors caring for their health? So work with medical providers to establish trauma-informed practices. And these are some of the things that I mean. Discuss how to create and respect boundaries with patients. So one of the things that I recommend in this handout that I'm going to give you is for survivors to sit with doctors and talk to them, or sit with professionals, healthcare professionals, and talk to them and say, okay, so when we have this exam, I need you to ask me first before you do anything, and you have to wait for me to say it's okay. And that's creating a boundary and having the healthcare professional respect it. Some people don't like it because it slows them down. Some people don't like it because it's not their normal way of doing things, and then they have to make themselves do that. So if you do training with medical professionals ahead of time, or if while you're there with a survivor, you help to stress this, it's really important. It will enable, and for me, I tell medical providers, look, here's the thing, I have this extensive trauma past. I know how to work with medical professionals to help to make sure that I'm caring for my health. So I want to lay out what that is. And if you don't feel like you can do it, that's cool, but I need you to let me know. Because if you say you can do it and then you don't do it, it's going to make it harder for me to care for my health. And so I'd rather you just tell me, oh yeah, that's not going to work for me, and I'll schedule an appointment with somebody else. So I think it's really important for healthcare professionals to know that, like, a survivor is coming in and they want to partner on their healthcare needs. They don't want to be, it's not a hierarchy. It shouldn't be a hierarchy of the medical professional up over the person with a condition. Because if healthcare is going to work, they're going to partner. There's going to be sharing of information, decisions made by the person that has it, and boundaries set. And so if they can't follow that, then they need to get out of the way so that this person can find somebody else who can. So how to create trauma-informed waiting rooms and examination rooms. The chaos in waiting rooms is really hard. And so if there's quiet areas where people can wait, if you're accompanying someone and they can wait in the car and you're in the waiting room and you can text them when it's time. But helping doctors, helping healthcare settings create rooms and areas that aren't as chaotic, that aren't as noisy, that don't have as many people walking around, that don't have announcements going on a regular basis. And I know it's really hard to do in emergency rooms, but to the extent possible, helping to limit that chaos will help people stay present while waiting and while having those exams. Asking providers to prominently display information about the health implications associated with child sexual abuse, and even like a brochure that you have, if your program has brochures, or that you might create in the future, that's going to help people feel like they're going to be understood. Going in and seeing information, like I live in rural Wisconsin, and when I was getting my vaccination for COVID, and I live in a conservative area of Wisconsin. If I didn't make that very clear when I said rural Wisconsin, I live in a very conservative area, and I'm gender nonconforming. And when I was talking to the pharmacy that I was going to go to get my vaccine, they said things that made me feel like they were pretty progressive. They asked me about gender, like how I identified, I mean, just stuff that like I don't expect out here. So it made me feel a little safer going there. And it's silly, it's a little thing, but those little things make a big difference for people with trauma. So train providers on screening patients for a history of sexual violence. Give them questions that they can ask, because those experiences of a trauma past will help them, like knowing those things will help them partner with the survivor on taking care of their health. So giving questions to medical providers around these issues would be really helpful. And then also reminding them that not all survivors will disclose, even if they're asked directly. So don't assume if somebody says no, that in the future, that's the case, that in the future, like they should know the prevalence of sexual abuse and trauma as children is really high. And the ACE study is a really good indication of that. Because the ACE study doesn't talk about childhood sexual abuse, but it talks about childhood trauma. So you could use that as a reminder. Okay, so these are all things that you can do to help survivors in terms of accessing health and accessing healthcare. So this is the brochure the handout that I've been talking to you about. It talks about victims of violence. It talks to them about why going to the doctor or the nurse is so hard for them. What can they do to make their visits easier? And there's more to it than that. But just so you know, you can take this and you can create your own brochure with it. You can print it out just like this and have it at your programs, and you can use this as your way of having conversations with survivors about their health and taking care of their health and getting health care. And it goes through the way in which I learned to take care of myself. And that's just a place to start. It gives them an idea, because see, what happens is if you ask people, so how do you do this? Like, how would you like your medical appointment to go? They're not going to know. They're not going to know what's even possible. So if you give them an idea of something, then they're going to be more likely to know. And I see one comment in the chat that I've definitely seen medical professionals treat people like a number. They're so quick to do things and they forget that there's an actual human in their chair. Amanda, that is totally right. And that's what your organization, you as an advocate in your organization can work against. And you can do it by trying to approach them when you don't have a survivor there. See if you can do training, talk to them about this. And then reinforce that when you're there with a survivor. The tricky part about all of this is our healthcare professionals are really burned out right now. Like I said, I live in rural Wisconsin, and I'm kind of lucky because within a half hour, there are, I'm going to say 3 or 4 medical facilities, medical clinics / hospitals. And so it's unusual in a rural area to have so many fairly close, and I'm doing air quotes around fairly close, but they're all really burned out right now. This whole thing about people not wanting to be vaccinated and whether COVID is real or not, and all the misinformation around vaccinations is really taking a toll. So I would proceed gently with healthcare providers right now. I would still try really hard to accompany survivors. It's a really hard time to deal with healthcare issues. And I would use all the protocols that the CDC recommends: wearing masks, washing your hands, social distancing, just to be safe. And then if you're working with survivors that have DID, I would recommend, and you don't have to do this just for survivors with DID, you could do this with adult survivors of child sexual abuse that have post-traumatic stress disorder as well. But I would recommend an emergency information card. For people with DID, having a card that maybe has your logo on it, that says, I have a condition known as dissociative identity disorder. I'm not mad, nor am I attention seeking, nor am I wasting your time. I have a history of severe childhood trauma, and DID is a coping mechanism for this. DID is treatable via psychotherapy. I have different parts. So you have the diagnosis, you're telling them what it is, and then in the card, you're telling them what you need. Please refer to me by this name. Please don't touch me. Please call this person. And so this is just an example of one. I have one that I took this and I made more kind of generic. And I've provided that to Leah as one of the handouts, to Leah and Alexandra as one of the handouts. So this is really, really helpful. If you work with clinicians in your area, I would share that with them. And you can give this to a survivor that you're working with that you know that has DID, for them to fill out just in case anything happens to them. And then have a plan, discuss with them what kinds of things could happen that could create a crisis. Who do they want involved to help them should that happen? Because that's who they're going to put in the card. And then create a card that's similar to this. And if you can put your logo on it or your name of your organization so that people see this as a legitimate thing, that would be really great. And then, and I've provided a handout with some language that you can play with. So I'm stopping there and checking to see if there's questions.
Yes, we do have one question. Someone asked,
Awesome.
how do you recommend we find trauma-informed providers? We don't have an established relationship with any providers, so not sure whether to start with relationship building or just calling around and asking openly about their practices.
Yeah, so what I would do is I would go to the providers that are in your area. So here things are mostly clinic-based. So meaning that, like I said, there's like 3 or 4 places around here and they're all associated with hospitals. So I would go there and I would talk to basically the person that manages, so not necessarily a doctor, but the person that manages the center. And I would talk to them about the fact that you guys, you're a rape crisis program, or you're a dual program. And a lot of the survivors that you work with have health issues, dental issues, vision issues, and trauma. And that you want to find someone to refer them to for these different things that can also work with them in a trauma-informed way. And so I would start there, and then in that conversation to see if they think they are trauma-informed, to really kind of hold that up and then find out what that means to them, and then offer to do free trainings for them, and just let them know, when you refer people, that you might be accompanying them or an advocate might be accompanying them. But I would just kind of start by going what's close by. And again, like I'm talking about a rural area. If you're in a more urban area, then I would go to the community health care centers first. In St. Paul, there are quite a few, St. Paul, Minnesota, there are quite a few hospitals, but there are also community health centers. And so these are the places that survivors tend to go to. They tend to accept more insurance. And then if you don't have insurance, they'll still take you. They work with immigrant survivors. They work pretty much across the board with nonprofits. So I would start there. And then I would ask them, who do they have? And then who would they recommend if there aren't clinicians, if there aren't professionals in their clinic, like a dentist or an ophthalmologist or an optometrist or orthopedics, like who do they send people to? And how do they do their work? So that's where I would start. I hope that's helpful. And thank you so much for that question. Also, let me put my email in the chat. If you're thinking about doing this, and obviously the coalition can help you, but also if you want to talk about this with me as well, you can email me and we can email back and forth or set up a time to talk. I have lots of thoughts about this.
We have a couple of questions, so I'm just going to start going down. So the next one that we got, and thank you for sharing your contact info, Olga. The next one that we got is, what is your definition or the direct definition of being trauma-informed, and how do we work with a trauma-informed mindset without possibly enabling clients to lean on advocates for day-to-day activities rather than using us as a bridge to get the healing they need?
Okay, so trauma-informed to me is when a program adapts their services to make it easier for people who are neurodivergent to participate. So, and it involves both physical types of changes and attitudinal changes, and then rapport and trust building. So the physical kind of changes is creating quiet areas, limiting how much stimulation there is light-wise or noise-wise, or people-wise. So like I said, emergency rooms are tough, but some places have like quieter alcoves where patients can wait. So people that have an understanding that folks that come into their program are going to struggle with some aspects of what their services look like, and make accommodations for it. Like they're already in place. You don't have to ask for it. So they're willing to do things differently. And a lot of places already do it differently. Like a lot of the things that I've talked about with what you can ask doctors to do, a lot of doctors are doing right now, or nurses are doing right now, or healthcare settings are doing right now. So you're likely not to come across too much resistance unless your area is just not doing that at all. But most places are. They look at soothing colors, they look at how they set up their spaces, they try to keep things fairly quiet, or they have quiet areas. And then the attitude is also recognizing that this person is trying to access help for themselves and not attention seeking, or not making stuff up, or drug seeking, or like being able to see that somebody's having a hard time and going with it rather than being suspicious. One of the things that I've seen in northern Minnesota, for example, when I've been up there and doing trainings and visiting medical healthcare settings, is that they'll treat people of color differently, and in particular Indigenous people differently. So they use the stereotype of an Indigenous person as someone who has addictions, and they use that against them. So they see that as drug seeking. So I call that kind of stuff out. I try to do it as gently as possible, but pointing out the stereotype and how what they're doing borders on racism, and that they can't treat all the Indigenous people as if they're drug seeking. People actually have pain. People actually are struggling. So I'm not sure if that's helpful. The second part of your question, in terms of, so how do you support a survivor without having the survivor become so dependent on you? So this is a larger answer, but what you do is, so adult survivors of child sexual abuse do need different kind of advocacy than adult survivors do. And the advocacy that I'm recommending is that you help them by accompanying them, but then you move towards making connections for them and showing them how they're doing it themselves well. Don't push, but gently kind of move people to that. Because initially, when someone's in crisis, it is really hard to do stuff themselves. When I'm in crisis, when I'm struggling, can't do it by myself. And so asking for help is really hard. And so if I ask for help and someone helps me, then I start working at trying to be able to do this by myself. And so that's what I would recommend. And the way that you do that is by helping to connect that survivor to other people in their lives. You do it through support groups, you do it through healing groups, but don't push people to healing. Advocacy looks different for adult survivors. It takes a little bit more time. So you I think have to do a self-assessment as to whether you have the patience to do that kind of work with survivors who were abused as children.
Thank you, Olga. Yeah, and I would just echo that and say, we talk a lot about our role as advocates is empowering survivors. And so, there's a difference, like empowering survivors and providing trauma-informed care and support. They go hand in hand. It's not, one or the other, I guess. So
exactly.
Things like helping a survivor feel more prepared to go to their medical appointments is empowering them in healing. Exactly. So I would just like think of it that way as well.
That's awesome.
So our next question, Olga, is, are there any type of funds available to survivors so they can seek out trauma-informed care that may be out of network for insurances? And I did write this person back and say that we can talk about that I would be happy to follow up with them. But just in general, if you have any knowledge of any funding options, because obviously that's a big issue.
Yeah, I don't generally. There's two things that I would recommend right now. So first, clearly every state has a Victims Compensation Act funding, or Victims of Crime Act funding. And one of the things that funding goes to is compensation for victims of crime. So I would look at that, and I don't remember, because it's been a while since I've looked at it, how recent the crime has to be. But I would look at your victims' compensation programs at the state level and do some advocacy around supporting adult survivors of child sexual abuse. So that's one source of potential funding for healing services, physical or mental health. The second piece is under the American Relief Plan, there is funding that are going to the states, and I don't know exactly where they're going to yet, but it's being administered by the Family Violence Prevention and Services Act, and that's funding for cash assistance for survivors. And so it's very likely that you'll be able to use that funding for survivors seeking trauma-informed care. And Leah, I have to run to another training.
No worries. Thank you so much for being here. I know I didn't even, I just looked up at the time and realized we were over. So sorry about that.
No worries. Usually I don't have them set up so closely together, and I'm usually happy to stay. So but today I did do that.
No worries at all. Thank you so much for being here, Olga, and we really appreciate you. And you'll be back with us next Tuesday to talk about trauma-informed and culturally competent legal advocacy. So folks, tune in for that. Alexandra, if you can drop the registration link in the chat for that, that would be great. And Olga, if you want to hop off, I can just close this out.
Okay, thank you so much. And thanks all of you for your comments and questions. I really appreciate it.
Thank you. Yeah, so just to pick up where Olga left off, and sorry, my camera's off. My pets are being really needy, so I don't want them to be distracting. Yeah, so Olga was mentioning the American Rescue Plan funds, and so some of you on the call may be familiar with that, and we are not 100% sure when programs are going to start seeing those funds come through, but it is in the works, I believe. You know, the funds have been released to the states at this point, I'm pretty sure, and we can stop recording.